to PHI, Public Health Impact. I'm Phaedra Corso.
And I'm Cham Dallas. And today we're going to introduce the Global Health Symposium, a two-day event, really having two different colleges of public health, one at the University of Georgia here, and the other at the University of Haifa in Israel.
And, you know, Cham, when we use this term global health, we're really talking about taking the public health principles and finding solutions to health problems that cross our national borders.
And the Center for Global Health here at the University of Georgia, it seeks to share these experiences and the best practices across cultures, across international lines.
But you know, when we're talking about global health, I sometimes get the impression that people think it means that we're going to these other countries and we're learning about their diseases and we're helping them figure out their own problems. But really, global health is going to other countries and learning about what they're doing right, what they're doing wrong, and then taking those principles back to our country and applying them.
That's right. For instance, Phaedra, Israel has lower cardiovascular mortality rates, has lower infant mortality rates, and has lower health care costs too than we do.
Yeah, and so I think it would be nice to see what is Israel doing with their healthcare system, and is that why they have better health outcomes?
Well, these two colleges of public health, we're going to see them interacting today in healthcare reform, in obesity, emergency preparedness, traffic safety. These are all issues that we're going to bring it together between these two different cultures.
So stay tuned for this exciting episode of PHI.
This Global Health Symposium is really the brainchild of Dr. Richard Schuster, who's the professor and director of the Center for Global Health. Anjali Matthew is the educational program coordinator of the Center for Global Health. So, Anjali, there are going to be a lot of people here at this conference. What kind of folks and why are they here?
Well, we're expecting UGA students, UGA's faculty and staff, and members of the Athens community, as well as several members of the University of Haifa. And it's going to be a great opportunity for faculty to meet our students. A lot of topics are being discussed, and this is also very much a cultural event in some ways as well.
Richard, why is this important to the people of Georgia? Why is this important to have a global health symposium?
Well, you know, Cham, that's a great question. I mean, what does global health have to do with the average guy sitting in his chair, or woman sitting in their chair in Georgia, paying taxes and asking why should UGA be doing this? The fact of the matter is we live in a global world, and I think a very simple way to look at it is to think of Delta Airlines. It flies all over the place. Its employees, many of its employees go all over the place, and it's highly dependent on a world that's very large. And we at UGA need to recognize that education, industry, economics, it's all around the globe. So we need to have global programming, and more specifically as far as global health, healthcare problems in the United States and healthcare problems in other countries are much more similar than they are different. Recently,
the University of Georgia, through the leadership of the Center for Global Health, signed an agreement, a cooperative agreement, with the University of Haifa, and that's going to be really the centerpiece of this symposium. Why don't you tell us what's the whole object of this, and what's the thrust that we're trying to do here?
Well, I think the thing to say is that we're looking for best practices of healthcare anywhere in the world, and we want to disseminate those best practices. One of the things we've done, one of the ways universities operate, is they sign cooperative agreements. And so we've recently signed a cooperative agreement between UGA and the University of Haifa, which is a large research-based university in Israel.
Now, I understand you'll be taking a big group of graduate students here from here to Israel next summer. Anjali, why don't you tell us what's going to come about with this?
Yeah, so next summer, July 1st to August 9th, we are taking a group of, Richard and I will be taking a group of 5 or 6 students to the University of Haifa. They'll be participating in Richard's course that he teaches here, Comparative Health Systems in Israel, with Haifa students present as well. And along with that, they'll be doing an internship, and so combined it'll be a 6-credit-hour program we'll be offering. And on the weekends, we will plan on taking day trips out, probably about 8 or so.
Wow, makes me want to wish I was young again. It was more on the student side of being a professor. But why don't you tell us a little bit about this graduate certificate program? We have a graduate certificate in global health now at the University of Georgia.
Well, that's correct, Cham, and we have a number of students in the program already. It's just a few months old. It's designed for graduate students during a master's or PhD experience to get a certain level of expertise in global health. And they have to take 18 credits. It's something that they can carefully do through a 2-year master's degree without extending their stay. They take the right courses. It involves a global health internship. Our study abroad program in Israel counts for that. So the courses and the internship really are part of that if a student wants to make it part of it, or for students who are interested in just doing, graduate students interested in doing study abroad, they can do that in Israel as well. Other thing just to mention about our study abroad in Israel this summer is we're actually going to be doing this with students from the University of Haifa as well. They'll be in class with us. We'll be teaching them as we learn together. So it's really going to be this mix of students together. And finally, I'm going to video teach the class back here to Athens. So I'll be in Israel giving my lectures and videoing back live to students here in Athens.
Well, I guess the final thing I'd say, why Israel? Globe, the earth is a big place. Why are we centering on Israel in this particular case?
Yeah. First of all, many programs in global health focus exclusively on low and middle income countries, what many people call developing countries. And we certainly are doing a lot with developing countries. But part of our interest is also in looking for these best practices. And Israel is a very developed country. They have very sophisticated health care. Their infant mortality rate is lower than ours. They have fewer disparities than we do. They have tremendous energy and emphasis on higher education. So when we identified the University of Haifa, it has a good Masters of Public Health program and a School of Public Health. They kind of seem like us. And we're hoping that we can learn from them, and obviously they will learn from us as well.
Well, I'm really looking forward to this Global Health Symposium. Thank you.
Thanks very much. Thanks for inviting us, and we're looking forward to this, and I think we're looking forward to having a good time taking students and teaching them in Israel as well.
Great. We now have with us Ofer Aviran, the Consulate General of Israel to the Southeast. Welcome.
Shalom, Dr. Dallas. It's a pleasure being on your show.
I'm so thankful that you are coming and being with us at our international symposium. I know that's really important to have the top diplomat in the Southeast to come here. Thank you for being here.
Thank you so much. Indeed, we were talking in the past about public health, and now we're moving to global health, where the UGA Center is really concentrating and trying to reach out other places, other destinations and nations. And we are proud as the Israeli people and government at the University of Haifa was selected by your side to be your partner on this event. And indeed, we are facing same challenges, Israel and the US, and we have to make a joint collaboration, joint effort to try to make a difference concerning how we deal with these challenges.
Yes, well, I think a lot of people may not realize that Israel is the only democracy in the Middle East and has the most in common with the United States.
Yes, Israel actually a very small country, as you know, smaller than New Jersey, about the size of the metropolitan of Atlanta, but at the same time of almost 8 million people, but a true democracy, indeed a true democracy, and committed to the same values that the United States of America and other like-minded nations are committed to, of democracy, of pluralism, of living side by side in peace.
What a lot of people may not realize is that there's a variety of people in Israel, and everybody gets to vote, and everybody participates fully in your society.
Indeed, about 80% of the society are Jews, and 20% are non-Jews, Muslims, Christians, and others, and they are full members, full citizens of the state, and have the full right to vote for the Knesset, our parliament, our Congress, and to bring their view. And the Israeli public is very like America, and know what they want. They change government from liberal to conservative and vice versa, because that's the idea of democracy.
It's just like here in the United States. Well, I've had experts from Israel teaching in my emergency preparedness program because they're the best in the world. But what other areas would you like to see increased collaboration between Israel and the United States, and particularly with Georgia?
Emergency preparedness, indeed, feel like health, IT, like water, solution when there's scarce of water in Israel, in Georgia, for example, to try to see how we can work together to make a difference and how we can learn from one another.
Well, thank you very much, Consulate General Aviran, and I'm looking forward to coming to your country in just a few months.
Come to Israel, you'll never be the same, we always say.
I'll be there. Thank you.
Thank you.
Now we have with us Dr. Manfred Green, who's head of the School of Public Health at the University of Haifa. And I'd like you to tell us, Manfred, a little bit about the different disciplines and tracks in your School of Public Health.
We have a School of Public Health that was established about 8 years ago, and we have enrolled about 300 students, graduate students at the master's level. And we have 7 tracks. 2 are administration tracks, health administration and health management. Then we have a track on health promotion, a track on epidemiology, occupational and environmental health. Another track, which is a different degree, but within our school, is a Master of Applied Nutrition, which is nutrition and behavior. So they do part of it, courses are in public health, and part are in behavior and nutrition. And there's a track which is probably fairly general on community health.
Well, Manfred, the University of Georgia and the University of Haifa have recently signed an agreement, as you know, for research partnership and for global health of study abroad programs. What kind of impacts do you see that having both here and in Israel?
Well, for us, this is a very exciting initiative because it means that we now have exposure to students and faculty from a very major university in the United States. And I think also it will give the opportunity to people from the University of Georgia to see something in a country which is obviously much smaller, but has all kinds of different problems, and it's also a very multi-ethnic society. Mm-hmm. And the University of Haifa, in a sense, is fairly unique in that it reflects the ethnic composition of the population. So about 20 to 25% of our students are Arab students, and so it's a very useful and good interaction between students and faculty.
You know, you and I gave a talk this morning together in emergency preparedness, and your field, syndromic surveillance, the way you look for diseases in a culture when they're popping up, how cross-cultural is that between, like, let's say, Israel and the United States?
Well, the concept of syndromic surveillance is to try and detect diseases at the level of signs and symptoms before there's an actual diagnosis. And you use it on a statistical basis to look for clusters of disease or increases in disease and so on. The syndromic surveillance, though, can be different culturally because it's based on signs and symptoms, and you may be having reported signs and symptoms for patients coming to doctors, which may vary from society to society, like headaches and fever and diarrhea and so on. There are some societies where they may present at the physician more commonly with these signs, and another society that not. I think in Israel and the United States we probably see similar behavior with maybe one minor difference, or maybe more than minor difference. In Israel there's national health insurance, so everybody has health coverage. Yeah. In a country maybe where not everybody has health coverage, you may have presentation in a different level, maybe at the emergency room more than at the level of the community clinic or whatever. No, so you may see differences in the way it's presented, where it's presented.
That's actually a very important point because we're in a, as you know, we're in a transition point right now, and that could be a very important point as we transition to whatever system we're going to here in the United States. Well, how important is a global or international experience in the field of public health from the Israeli point of view?
I think generally not just from the Israeli point of view, but you're right in that when we're in our own closed society, we seem to view every disease or every problem as a major problem and as a unique problem, and we look for solutions on a kind of unique basis. And when we move out of that, we recognize that most of these problems are universal problems, and most of the problems that are faced in the United States and in Israel are very similar. So I think, but the approaches to them might be somewhat different. So I think it's very important for our students and our faculty to exchange, so that we can be exposed to these different approaches to similar problems, and of course to recognize different problems and to learn about them.
Well, thank you, Dr. Green. That's very enlightening, and we really have more in common than people might have thought.
I'm sure. Thank you very much.
Well, we're here now with Shira Selber-Sagi, who's a dietitian and epidemiology expert from the University of Haifa School of Public Health. Shira, maybe you better explain to us exactly what is a nutritional epidemiologist.
Well, nutritional epidemiology is one of the most interesting and evolving fields now in the field of epidemiology, since it deals with the association of nutrients, micronutrients or micronutrients, with health outcomes. And I mainly focus on chronic diseases as cardiovascular disease, diabetes, or non-alcoholic fatty liver disease.
Well, what are the biggest challenges? I suspect that they're very similar between Israel and the United States. What are the biggest challenges now being faced in Israel having to do with population and nutrition?
Well, the first biggest challenge is the obesity issue, which it might surprise you, but actually the percent of obesity in Israel is quite similar to the one in the United States. We have about 23% prevalence of obesity in Israel and around 60% of overweight. So this is quite similar to the United States. Furthermore, we have heavy nutritional problems with the overconsumption of fat, calories, and especially sugars.
Well, the title of your panel section that you're in charge of has interesting wording: overnutrition, a global problem. Maybe you tell me, why did you pick those particular words?
Well, if nutritional epidemiology in the past had to deal with undernutrition, this is not how it is nowadays in the Western population. We overeat. This is as simple as that. We overeat everything: calories, saturated fat, coming from junk food and industrial food. And I mainly focus in this talk on added sugar that is added to the food in large amount by the food industry. Actually, this is the industrial food containing a lot of sugar, more than we are supposed to eat.
All right, well, tell me, how are we going to eradicate this? I mean, we've had a real problem with this in the United States and apparently also in Israel, and yet we haven't been able to turn this around despite efforts in that direction. What do we do to make this turn around?
First, we have to recognize how big is the problem. And the problem is big, and there is a lot of evidence in the literature demonstrating a very, very strong association between overconsumption of sugar and especially soft drinks sweetened with sugar, and obesity and weight gain. This is very highly demonstrated. We now have data from Israel and from the United States demonstrating that the daily consumption of soft drinks is very high in both countries by adolescents. It reaches 45% of the adolescents in Israel. They consume daily soft drinks. And in the United States, it's about 35%. And in both countries, this is higher than the world average. So that makes it a very serious problem in the health of children and adolescents, which then become obese adults. So we need to face how big is the problem. And then we must recognize that we have to do some policy changes or education changes in order to overcome it.
What policy changes do you recommend? What's the sledgehammer that's going to turn this around?
Well, it's not my original idea, I must say, but in recent literature, there have been some recommendation to put taxation on soft drinks, which might be a good way to reduce their consumption. We have a good example from cigarettes, from tobacco taxation.
Well, also with alcohol, we taxed alcohol and are continuing to increase taxation on alcohol, and it's been pretty effective in knocking consumption down.
Yes, this makes a great example for something that might look impossible to perform, and actually it is possible and it is working. And I think we have a lot of evidence now and a lot of justification to do the same thing with soft drinks.
Yeah, well, maybe if we'll try it here, we'll come back and give you the credit. How about that?
I would love that.
Yeah. Thank you, Shira.
Thank you.
This Global Health Symposium is a partnership between the University of Georgia and the University of Haifa. And now we have here with us the rector of the University of Haifa, Dr. David Faraggi. Now, I'll have to tell you, in our parlance here in the United States, we're not really sure of those titles. Tell us about the job of rector and what does that mean in the university system?
Yeah, the rector is really the provost of the university. In terms of the American system, it's just a provost. I'm in charge of all the academic affairs of the University of Haifa.
What's your academic vision, particularly in view of this new collaboration between the University of Georgia and the University of Haifa?
Right. Well, University of Haifa is the youngest university in Israel. Of the research, we have 7 research universities in Israel. Haifa is the youngest one. And I just started my position as the rector of the university just a year ago. And the first and the foremost thing that I would like to do in the university is making it more international. And that's why we are all here.
Yeah.
We would like to expand our international relations with institution to institution and mainly create more academic programs, mainly master's programs that will be taught in English. And we don't have it yet. All we have so far is what we call, and you have study abroad programs that undergrads from the United States mainly are coming to Haifa and do a couple of 3 months or up to a year in Haifa and transfer credit to their own institution. What we are trying to do now and what I'm putting forward is to make the University of Haifa a more international university and build it. And I have to start with building the academic structure, namely building all the programs in English rather than Hebrew, what we have so far.
And this Global Health Symposium that we're doing here now between the University of Georgia and the University of Haifa is a great example of this kind of really close collaboration that's possible with Northern Israel.
Yeah, exactly. I mean, this is exactly why we are all here. I think this is a great starting point. We have great relationship. We had a great visit here. We met with so many people here. And there are so many opportunities, there are so many similarities between UGA and Haifa University that I see many, many possibilities. And we are going to invite people from here to come to Haifa for a visit. A group of people, a student is going to Haifa in the summer to do a short course there. I'm sure that many of us will come back and we'll start building the bridges.
Yeah, that's what we want. And we are glad to have this relationship with you.
Thank you very much.
Yeah. We're here now with Dr. Harold and Millie Solomon, who are really responsible for our international symposium here. And we really appreciate that. Actually, this series of support for you goes over time. Dr. Solomon, what's your vision for this? Why are you helping us out so much here?
Well, when I originally donated to the College of Public Health, it had several motives. First was to repay the University of Georgia for a great education that I got 50 years ago. I graduated 50 years ago. Second was that I wanted to connect Georgia with my cultural past, which is as a Southern Jew. And the third thing was that there was a drought in Atlanta. And I thought that the College of Public Health would embrace the idea of studying water management or some sort of political or chemical aspects of water that the Israelis have pioneered. The response was, we love your money, we love the contribution, but we are much more interested in what the Israelis know about mobilization for mass casualties. And this has morphed into global health. I mean, it's very exciting.
Well, I'm particularly thankful for it since I'm in emergency preparedness and what we've learned from the Israelis, thanks to your support, Dr. Solomon. I have to admit, though, you have another reason for being so appreciative to us. I believe you and Millie met as a result of your interaction with the University of Georgia.
That's right. We came to a reunion 18 years ago in Atlanta. Both of us had been divorced, and we came to the reunion single, and I met Harold, and we got married 4 months later, and I moved to Boston.
Well, the University of Georgia helps people out in many ways.
That's right.
And that's not the first time I've heard a story like that here, and we're glad for that. You know, this support and this interaction you have, you're really a fundamental part of our college, Dr. Solomon, both of you are. And what's the vision for the future? I mean, you've been helping us for years, and you've helped us interact with Israel in many ways, emergency preparedness in my areas, but what's the vision for the future?
Well, it's astonishing to me to come back to Athens. 50 years ago was a pretty homogeneous environment. Now it is global. It is a global university. And the Israelis, newly come to several areas of expertise, have things to teach the world. So I don't see this as a partnership with the University of Haifa so much as I see it as expanding the influence of the University of Georgia globally and some of the Israeli universities as well.
Well, we really appreciate it, and I'm looking forward to the future for Israel, the United States, and with the University of Georgia and with you. Thank you very much, Dr. Solomon, Millie.
Our pleasure.
Okay. What a great two-day conference on global health symposium. I really feel like I've really crossed some borders here.
Absolutely, and I really met some wonderful participants at this conference. I met students from all over the university, both undergraduate and graduate, from pharmacy, from social work, from the College of Public Health, of course, and lots of community members in the audience as well.
And this is only the beginning. There's all sorts of vistas out there in other countries that we're going to be pulling in later. In
one of our previous episodes, we highlighted Mannheim Institute of Public Health in Germany. And so I think that's just another example of how we're starting these great opportunities for students and faculty.
Yeah, and this is a research for the faculty and the students, and really this broadening of the horizons for both faculty and students. This study abroad is really critical for that.
So I hope what we've shown today is that when we use the word public health, we're really talking about global health.
So join us for the next episode of Public Health Impact, PHI.